Welcome to This Week Health. My name is Bill Russell. I'm a former CIO for a 16 hospital system and creator of This Week Health, where we are dedicated to transforming healthcare one connection at a time. Now, on to our interview.
All right, I am so excited to be at HIMSS in Las Vegas. There are 30,000 people here this year, so I feel like I've made a huge resurgence, and I'm super excited to be with you, Julie. So thank you for joining me for an interview. Would love for you to share a bit about you and your role at University of Chicago, and also what brought you to HIMSS this year.
Absolutely. Thank you for having me. My name is Julie, and I am here on behalf of MDClone, who is one of our vendors, because I run the Center for Research Informatics at the University of Chicago, and we're in the Biological Sciences Division. And so one of the things we do is enable data-driven research, but we have partnered with our health system very closely to really transform how we do both research and operations with data and to really enhance our learning health system.
I've heard about MDClone over the years, so it's a footprint that's continuing to grow. What was the genesis of your partnership with them?
That's a great question. Actually, I was able to visit their headquarters in Israel a few years ago when we were really looking for a solution to a post-COVID financial crisis in our academic medical center. And we really needed data at our fingertips faster in order to make data-driven decisions. And so when I was invited to go check out the product, I'd be honest, I was a little skeptical at first. Sure, that can it do all of these things that we want it to do, which is protect our privacy, put the data into our hands faster, but it could. And so I ended up being very engaged with their product development team while I was there, just excited about it, and brought that back to the university and our health system and said, hey, we really need to get this a go. I think there's an opportunity here to really change how we work with data.
And data is one of the 4 biggest topics here at HIMSS this week. Kyle Wolf, you might have been at his keynote or heard him talk about like data and digital transformation and workforce shortage and usage of AI in a way that's all about making sure the data that you're utilizing is clean, that you have access to it. You can make great clinical decision support decisions with it, primarily because it's part of the equation and is not the equation.
Yeah.
So all these, like the rapid evolution of what's happening in the agentic space, etc. How are you simulating all of that into your practices, whether it's governance, whether it's use cases? Like, how are you finding these coming together at University of Chicago?
You really hit the nail on the head. We really need data in our fingertips to do what I like to say and use a lot is, how do we fail fast and pivot quickly? Because the way we typically work in our organizations is a very slow roll through data. You don't know you're missing anything until many months later. And then you get that data and you say, oh, shoot, I really need to ask it slightly differently. And when you have a product like MDClone, you can ask that question, see the answer, know immediately if you need to pivot. We like to say, did you have a cocktail napkin idea, right? Like you framed up this really great question and you think you want to move it forward, but how do you actually do that if it takes 6 months to get the data into your hands? And so when you have this type of self-service tool and literacy around how to use the tool and appropriate governance, we spend a lot, I think that's where we're stuck in many ways, is how do we democratize data and also trust people to use it appropriately and quite frankly not sell it, right? We don't want people selling our data, but how do we do that? And I think that's where we're really spending our time and effort right now, is on putting it in the right people's hands to make the right decisions, but also putting the right governance in place to protect our patients.
What you're doing from a data bias perspective is you use more and more data. Now you've got a huge footprint, so you get access to a ton of data that you can utilize and bring into your different goals and functions. Are you ever sourcing external data?
Yeah.
And then how are you also making sure that either the appropriate level of bias is reviewed or removed, and knowing where to source new information to grow your capabilities?
Yeah, we always start with the patient first, and then we start with what do we need to know about those patients. So we source our data primarily from our medical record, our data warehouses, and ancillary systems that touch the patient. I think a lot of folks forget that each of the systems that touches a patient generates its own set of data, and it's not always put in the medical record in an optimal way. So on my side of the house in the research world, we actually try to source it direct from source and then feed it into platforms. From external sourcing, we're a big research powerhouse, right? So we really follow the science and we follow our researchers. Right now, the sort of socioeconomic, socio-demographic impact is huge. At the university, we've coined a term sociome through our CTSA, which is really the study of all the other things that impact health. And with that, we're using things like area deprivation index and census tract data, and we purchase the National Death Registry and harvest it back into our medical records. who's dead or alive. It sounds very basic, but you really should know everyone in your medical record who's dead or alive. And quite frankly, most institutions don't, because that's just how it works. So we work with that type of data and our physician scientists to say, hey, what is it you want to know? And what do we need to bring in? And it's very iterative. Once we find a data set, we work with it, and then we bring it back into the warehouse to make it available for everybody else. So it really drives from the bottom up and then the top there.
When you went into this partnership and you had certain expectations from the things that you had seen, how has it exceeded your expectations? And what are some of the things on the horizon that you're like, now that you have that trust built with them as a partner, what comes next?
Yeah, so it's funny. I gave this talk with their invitation a while back, and I left one word on the table: partnership. And so that's how I ended. I actually feel like I'm a part of MDClone's family in some strange way. I get hugs when I come. They truly do care about what they do, and I can't always say that about vendors. That they really, selling a product is one thing. They're selling an idea, a mission, a way to transform how we do things. And we bought in. And so I think with them, it's really about what next. I've talked to the founder, Azeeb Ofek, about some of my ideas about the various data sources that we have on just our campus alone that would be really interesting to somehow figure out how to get into a platform so that we can work with things like socio-demographic data in a more robust way. Where we're situated at the University of Chicago, we partner with the city quite often. And so we have not publicly available data sources, but agreements in place that allow us to do some research with these data sources that may or may not otherwise be available to studies. And I think that would, for me, be an exciting next move, is to say, how do we use environmental data from our capsules all over the city of Chicago? How do we use the now defunct ShotSpotter data to study gun violence on the South Side? These are just my ideas, but I've brainstormed with Zeeb a bit. What about crime data? What about our fire and police data? All of those things are data sources available in repositories that really could be mapped to the patient level to drive transformational public health change.
How are you also using a lot of this data and information to get in front of what is coming in terms of the physicians? Two things: shortages, that's clinical across the board.
Yeah.
Also burnout. How are the tools and the way that you're feeding tools for information helping a couple of these systemic issues that we're seeing all over the country?
Yeah, I would say not with MDClone, but hopefully we'll be able to get there with this, but with a partnership with the data, is that we've actually purchased or are partnering with a Bridge, which is a tool here on the ground.
One of our partners.
Okay.
Yeah.
And I'm not yet as familiar with it because I'm not at the bedside anymore, but it's the ambient listening tool. On the hospital side of our house, they're working with that data to drive change related to physician burnout. But there's also the sort of pragmatic trial or pragmatic study of how does that actually impact the patient deliverables, the patient care, our education within our medical school. Does a predefined note take away from the learning opportunities, but may not be a part of the hospital's sort of implementation mission? As one of the things that we're doing in my group is partnering with that implementation team to bring that data in to study those questions, the research questions that maybe aren't within the first pass of implementation.
What else about being here are you looking forward to seeing and getting out and about? Heck, it's only really the first day that we're all here. Some of us have been here for a few days for myriad reasons.
Yeah.
And as you think about the things you're also looking to solve for, conversations you want to have, what does a successful end of week look like for you here at HIMSS?
It's networking, it's meeting new people, hearing how they're doing things or solving the same problem. Just with our MDClone collaborative partners alone, I've spent 3 hours today troubleshooting, talking about their governance structure. Governance is a big part of what I do in my daily work, and it's never going away. And so how do we do that and do it well? And learning how other complex medical centers, academic hubs do that in the way they think about it, and how do they drive change that way? How do we protect the privacy of our patients, secure our data, but also democratize it? So I really look forward to talking to other folks on the floor about those endeavors. There's a lot of really cool stuff around here that I can't wait to go and check out. But as an old clinical nurse, I always like to go look at some of the cool new bedside tools as well and dream about how it used to be when we didn't have any of this fancy stuff at the bedside, but it's not as much of what I do anymore.
With your impact at University of Chicago, you've been there almost 18 years, you noted. Clinician by trade, all about the data today. When you do see a great bedside tool or you do see something that you're like, gosh, I wonder if we're thinking about that.
Yeah.
How do you still bring those ideas forward into your organization?
Yeah, that's a great question. I don't have as much impact on the hospital side in terms of purchasing power, but because of actually a lot of what we do with data. We have strong partnerships with our chief analytics officer, our chief of quality, supply chain, et cetera. I mean, we are bringing all of this various data sources together. And so if there's something cool and fancy that should be floated after 18 years, I'm certainly not afraid to say anything and drop a line to somebody. But it's not my position to make those partnerships, unfortunately. I have more influence on the university side.
So long as, though, you get to bring a lot of great ideas back, share your knowledge. It's the whole point we come to the conferences, sharing the knowledge and just knowing that we saw something or had a conversation with somebody. You never know when those things bubble back up and are super helpful.
Yeah.
Thank you so much for sharing about your journey with MDClone. Again, I've heard about them off and on for years, and I love what they're doing. And when you hear it about it firsthand, how a major university is leaning into how you're improving patient care, demographics, all the different pieces come together. It's really enlightening. And I love that you're doing Bits of the Bridge too, because they're one of our partners, and we're a big fan as well. Yeah, great to meet you today. Thank you.
Thank you, Sarah.
For being here.
Absolutely.
Yeah.
All right.
That's all from HIMSS. Thanks for listening.
Thanks for listening to this Interview in Action episode. If you found value in this, share it with a peer. It's a great chance to discuss and in some cases, start a mentoring relationship. One way you can support the show is to subscribe and leave us a rating. If you could do that, would be great. Thanks for listening. That's all for now.